Hi, my name's Chris Ebert, and it's really kind of interesting and to me humorous that I'm introducing the topic speaker on nutrition, because for those of you who don't know, I was a United Airlines pilot for 23 years, and the airline food's not really known for great nutritional value. So I was diagnosed. I was on a 4-day layover in Boston, Massachusetts. And it had been a really long day. We put the airplane to bed. We got the flight attendants their rooms, got the co-pilot squared away, and I went and laid down and felt something on the right side of my right breast. And you know how sometimes deep inside you just know that's wrong. And 4 days later, I was being told that I had an invasive lobular carcinoma. As soon as they wrote that on the paper, the FAA grounded me, so I lost my job. And within a month, they told me that it was a stage 4 with multiple metastases throughout the bones of the spine. I have gotten a lot of prayer, and as many of you, my faith has sustained me well. And I am currently showing no evidence of disease. And I've learned a lot about nutrition, but I have a lot more to learn. Just a reminder, if you have a question, please fill out the little cards for the Q&A. Somebody will pick them up and they'll answer, Miss Mandy will answer questions at the end. It's my pleasure to introduce Mandy Holliday. She has 8 years of experience as clinical dietitian at the University of North Carolina Healthcare System, 3.5 of those years specializing in oncology nutrition. As a member of the UNC Comprehensive Cancer Center program, she counsels patients on ways to maintain adequate nutrition during the course of their treatment, and she lends her expertise to survivors as they strive, as all of us strive, to adopt healthier lifestyles. Please join me in welcoming Mandy.
Thank you so much. Hi, good morning. It's an honor to be able to come here and to be a part of this conference. I'm going to try and cover a lot of information in a small amount of time. So if you think of a question, please write that down and hopefully we can get to it at the end of the presentation. We have a few objectives that hopefully we can meet today. First, to understand the role of nutrition in the context of the cancer diagnosis and during treatment. To learn some dietary strategies that may be helpful when you're dealing with certain side effects, to identify certain dietary and herbal supplements that may be used in dealing with side effects and symptoms. And then also we'll try to conclude with addressing certain controversial foods and nutrients that you may have heard about in the news. So I think we can all agree that nutrition is important, otherwise we wouldn't be here talking about it today. But why is it important? Well, we know that it's essential for maintaining those nutrient stores and also maintaining muscle mass. When you're not getting adequate nutrition, your body's going to resort to whatever means it can to feed itself, and that means going to your muscles and breaking those down. And with that, there can be increased fatigue. You can have decreased strength, so it's more difficult to do everyday activities. Also, adequate nutrition is helpful for managing side effects, and so all of this can really affect overall quality of life. Also, with adequate nutrition, there's the potential for fewer complications, a lower risk for infections, less hospital admissions, and treatment breaks. So I have a couple of graphs here. They come from a randomized control trial that was done with individuals with head and neck cancer as they were getting radiation therapy. There were 3 groups involved in this study. The first group, the control group, was basically diet ad lib. They were on their own. The second group was receiving high-protein supplements twice a day. And then the third group was also receiving these high-protein supplements in addition to counseling with a dietitian on a weekly basis during their treatment. You can see the second point here at the end of the radiation treatment, the group that received the high-protein supplements and the group that received the supplements plus the counseling they were able to increase their caloric intake compared to the group that was just diet ad lib. However, if you look 3 months out, it was really only the group that was receiving that counseling with a dietitian on a weekly basis that was able to maintain their nutrition status. And so the reason I share this is that if you know that nutrition is something you're struggling with, you have a poor appetite, you feel like you may not be meeting your needs, it may be worthwhile meeting with a dietitian. But besides that, sometimes it's helpful to have somebody there who's keeping you accountable. Maybe it's on a daily basis, maybe it's on a weekly basis. They're checking in, how are you doing? Something else you can try is if you feel like you're struggling in this area, maybe keeping a food diary for 3 days at a time and getting an average on, what's your caloric intake, what's your protein intake. There's a lot of great websites where you can track your food intake, like choosemyplate.org. They have a food tracker that's available. The next graph just looks at protein intake, and once again, you see similar results here. We know that because of the nature of the different treatments you may be receiving, that there's a higher increase for other health issues, such as heart disease, osteoporosis, and diabetes. And each one of these health issues carries with it a nutritional component. If it's possible, increasing your intake of plant-based foods can be helpful. A variety of fruits and vegetables, focusing on whole grains and limiting the amount of refined carbohydrates that are in your diet, such as white bread and white rice. In terms of bone health, making sure that you're getting adequate calcium and vitamin D, and I'll speak to that more later on. Also with diabetes, reducing your intake of sugary beverages, and that includes juice as well. So we're going to look at a few side effects that can be common. First, we have poor appetite, and with that, the potential for weight loss. Now, sometimes folks will say, my appetite's not great, but my weight really isn't going down that much. And that may be the case, but you may be losing muscle mass. Like I mentioned before, if you're not getting the calories that you need, your body's going to go to whatever means it can to get that nutrition. So you may be losing muscle mass even though your weight may appear to be relatively stable. Sometimes folks will say that they get full really easily. They say, well, I'm still eating 3 meals a day, but they're just smaller meals. And one thing that may be helpful is to incorporate some snacks in between those meals, or doing 5 to 6 small meals. And sometimes I'll have folks that'll say, my loved one, makes me this huge plate of food and I just can't eat any of it. But they find that if it's a smaller portion, it's more manageable, and they actually may eat more when it's that smaller portion. When you are eating a smaller volume of food, you want to pack a lot of calories and a lot of protein in that smaller volume. So that may mean if you're having fruit, maybe have some yogurt with it. Maybe it's apple slices with peanut butter, or some veggies with some hummus. Something where you're always getting something that's high in protein along with whatever you're eating. Sometimes, too, it helps to think of food, if you're struggling in this area, to think of it as medicine in a way. Sometimes you have a regimen with your medications, a schedule that you're on, and sometimes you need to do the same thing with food. Maybe that's having an alarm set saying, at this time of day, if I haven't had anything yet, I need to eat something small. Also, sometimes light activity can be helpful. It can help stimulate your appetite. It doesn't have to be too vigorous. Maybe it's walking to the mailbox, walking up and down the stairs once before a meal. Just something small may be helpful. And then there's also a number of nutritional supplements that are out on the market, such as Boost, Ensure, or Gain, just to name a few, that may be helpful to have in between meals. Fatigue is probably one of the most common side effects. There can be a variety of causes. Like I mentioned, one may be that you're not getting enough calories and enough protein, and you're having that breakdown of the muscle mass. Also, you may be dehydrated. That can really affect your energy levels. For most individuals, they need at least 8 cups, 64 ounces of fluids a day, and that can be water, it can be juice, it can be tea, broth and soups. All that would count towards your fluid intake. If you're the one that primarily makes your meals, and that can make it more difficult if you have that fatigue, on those days where maybe you have more energy and you feel like cooking, making extra batches and freezing them for later. Also, friends and family members often want to do something tangible, and food is a good way that they can help. So maybe providing them with some recipes that you know you enjoy and that you can tolerate, and then they can make those extra batches and put them in the individual containers that can be frozen, and then you can bring out as needed. As with poor appetite, sometimes a little bit of light activity can be helpful. So once again, maybe walking around the house. Nutrition plays a role in maintaining that muscle mass, but also using those muscles can make a big difference in preventing them from being broken down. If you struggle with nausea and vomiting, probably the first line of defense is taking your anti-nausea meds. Sometimes it may be necessary to take those on a schedule. A lot of doctors will prescribe those every 6, every 8 hours as needed, and you may need to take it every 6 or every 8 hours. These medications usually work best before you feel sick versus after when it's too late. Also, it's helpful to select bland or dry foods, nothing too rich, nothing too greasy or sweet. Sometimes those foods can make nausea worse. A lot of times folks will say that smells really bother them. So definitely, if smells are something that trigger nausea for you, being away from food is being prepared. Also, maybe eating more foods that are served at room temperature or cold so they don't emit those strong smells. Also, we recommend drinking the majority of your fluids in between meals. That may be helpful as well, separating your liquids from your solids. And as with poor appetite, it may be helpful to have those nutritional supplements, those liquid supplements in between meals. For some folks, ginger can be helpful with dealing with nausea. However, there are mixed results when it comes to how ginger can affect chemo-induced nausea. Sometimes we'll encourage folks to select ginger-rich foods and beverages, such as ginger ale that has real ginger in it, or ginger tea. You can even make your own ginger tea by adding just a few thin slices of ginger to your tea as it brews. Also crystallized ginger, or I know they sell the ginger chews that you can find in a lot of stores. Typically, we don't recommend taking it in a supplement form, but there have been some studies that have looked into ginger supplements. They typically use about 1 gram a day, and this is in divided amounts throughout the day. They recommend not taking greater than 4 grams. There are some contraindications with using a ginger supplement if you're on any kind of blood thinner or NSAIDs, because there can be the increased risk of bleeding. If you're diabetic and you're on insulin or any anti-diabetic meds, it may drop your blood sugar even more so. And also if you have a history of gallstones. Sore mouth and sore throat may be an issue. Definitely avoiding anything spicy, acidic, such as tomato products, citrus fruit. Also foods that have a rough or coarse texture, such as chips or crackers or toast, things that would just cause further irritation of your mouth. Also, you may want to avoid a lot of caffeine and alcohol, which can dry your mouth and once again cause even more irritation. You can try a homemade mouth rinse with salt, water, and baking soda and just use that throughout the day. That may be soothing. If the sores are severe enough, there is a medicated mouth rinse that your physician may be able to prescribe that you can use before meals that may help with eating. One other thing you can try, and this is more anecdotal, but sometimes honey is helpful. So maybe having some warm tea with maybe just a 1/4 teaspoon of honey. Honey has antibacterial and anti-inflammatory properties, and sometimes it may help in speeding up the healing of those sores. If you struggle with taste changes, especially if it's a metallic taste, the first thing we recommend is switching to plastic utensils. Also, foods and beverages that have a tart or sweet flavor can be helpful. So maybe adding lemon and lime to your water or using fruity marinades. Also, vinegar can be helpful. So using like a vinaigrette as a marinade or just adding it to foods. I had one lady that would add a lot of pickle relish to food. She said that really helped her with eating because she could taste that. If you're not having any issues with mouth pain and you're not having too much nausea, maybe it's just increasing the use of different seasonings and spices. And also you can try the homemade mouth rinse with the salt, water, and baking soda. Sometimes individuals struggle with constipation, especially if you're on any kind of pain meds. Sometimes it may be necessary to use a daily regimen of a laxative and stool softener. In terms of diet, we have what we call the 3 F's, so starting with increasing your fiber intake. For most individuals, this may be between 20 to 30 grams a day, so increasing your intake of fruits and vegetables, whole grains, using whole wheat bread, whole wheat pasta, brown rice, nuts and beans and seeds. If you don't have a lot of fiber in your diet, you want to gradually increase this. You don't want to go from 5 grams to 30 grams because that will definitely make matters worse. Besides that, if you're not getting enough fluids, that can also complicate matters. So as you increase your fiber, you want to increase your fluids. And like I said, for most individuals, that's probably around 8 cups a day. As I mentioned, water, juice, broth, all those would count towards your fluid intake. Sometimes hot liquids can stimulate your guts. So maybe it's having some warm tea or some hot water with some lemon added. Also, prune juice, apple juice, pear juice, they're high in sorbitol, which can act as a laxative. So maybe having a quarter cup of one of these juices warmed up may also help out. And then we have our 3rd F, physical activity. Once again, it doesn't have to be too vigorous, but just getting up, moving around. Sometimes the act of gravity can also be helpful. And then if you know that it's really hard to increase the volume of my intake, I'm unable to add a lot of those high fiber foods that you mentioned, maybe using a fiber supplement such as Benefiber, Metamucil, or even adding some flaxseed to your foods and shakes and things. On the other end of that, we have diarrhea. So those foods I mentioned that you want to increase with constipation, those would be the foods you'd want to cut back on because that would increase output. But there are 2 different types of fiber. We have insoluble and we have soluble fiber. Soluble fiber absorbs water and it can slow things moving through your gut. Foods that are high in soluble fiber would include bananas, applesauce, white bread, white rice, oatmeal. Like I said, they'll absorb that extra water and slow things moving through your gut. Also, if you find that you're having a lot of diarrhea, it's probably helpful to add some of that healthy bacteria back through using yogurts. If you're purchasing yogurt, you want to find yogurt that contains the live cultures and not just simply is made with live cultures. If it just says made with, a lot of that bacteria may have been killed during pasteurization. Once again, make sure you're getting plenty of fluids. With each episode of diarrhea, you need to have an additional cup of fluid. Also, you may want to cut back on caffeine because that can stimulate the gut too, so switching to decaf may be helpful. So next, I just want to talk about a few dietary supplements. But first, sometimes there are some myths surrounding dietary supplements. Sometimes, you hear about a certain nutrient or phytochemical, plant chemical in the news and how it's helpful, and then immediately people want to start selling supplements based on that particular nutrient. And yes, it may be helpful in whatever effect it has, but there's a threshold where yes, it can be therapeutic, but then it can become toxic if you're taking extra high doses of that particular nutrient or phytochemical. Also, sometimes individuals think, well, it's natural, it must be safe, but this isn't always the case. There can be a lot of different side effects. I mentioned ginger, how it can be contraindicated with various things. Some of these herbal supplements may interfere with certain treatments as well. And then also sometimes we sometimes think, well, the FDA's got it under control, and unfortunately, a lot of the burden of proof lies on the FDA, and they don't have the manpower to investigate every single supplement that's on the market. So sometimes what's on the label may not be necessarily what you're getting in the container. But one thing you can do when you are purchasing a supplement, one thing you would definitely want to look for is the USP code. This is the United States Pharmacopoeia. They're an agency that can verify the quality, the strength, and the purity of supplements. It doesn't speak to the safety and efficacy, but at least you know that what it says it contains, it does contain. So always look for the USP code or the consumer labs as well. But first I just want to talk about multivitamins. They're a very common supplement that's used, especially individuals with cancer. That's just like the first line of defense. Sometimes when you feel like you're not getting enough of the nutrients in your diet, that's a lot of times what people will go to. Recently in the news, there's been some questions as to whether it's safe to use multivitamins. In terms of cancer-related mortality, the results are really mixed. One study found that there was actually a 30% lower risk of breast cancer-related mortality among women using a multivitamin compared to women who weren't using a multivitamin. These were women with breast cancer. They were followed for, I think, at least 7 years. On the other end of that, there was actually a study looking at 4 large prospective studies, and they found that there really wasn't any impact of using the multivitamin on breast cancer-related or all-cause related mortality risk. In terms of taking a multivitamin during treatment, during chemo and radiation, there's still insufficient evidence. And one reason we're concerned about whether it's safe to use a multivitamin during treatment is because of the high amounts of antioxidants that can be in these supplements. Theoretically, antioxidants may preserve cells that the treatments are trying to kill, but on the other hand, they may preserve healthy tissue. So we're not really sure if it's helpful or if it could actually be detrimental. One study, the LACE study, the Life After Cancer Epidemiology study, found they looked at a couple of different supplements that are very potent antioxidants. They found that among women using vitamin E and C, which are once again very potent antioxidants, that it seemed to decrease mortality risk. However, they found that women who were taking carotenoid supplements, carotenoids are naturally found in your red and orange fruits and vegetables, they found that when taking it in a supplement form, there was a 2-fold greater increase in all-cause mortality. So it appears that it may vary from, phytochemical, vitamin, to, it may vary among those different supplements. Also, there hasn't been enough research, so we don't really know what would be the recommended dosage, what would be the recommended duration of taking these supplements. So those are still questions that need to be answered. Vitamin D, this is probably something you've heard about a lot in the news over the past few years. Vitamin D is a fat-soluble vitamin. It can also act as a hormone. It's naturally made by humans and animals when our skin is exposed to the sun. There are a few food sources that are listed here, such as fatty fish, all milk is fortified with vitamin D, egg yolks, cheese, some mushrooms that are exposed to UV radiation. When you're having your vitamin D levels checked, you want your doctor to look at the 25-hydroxy vitamin D levels. In terms of what research has found, we know that vitamin D is helpful in increasing the blood levels of calcium. In the absence of vitamin D, we're only able to absorb 10 to 15% of the calcium in our diet. In the presence of vitamin D, that goes up to 30 to 40%, so it makes a big difference. So this is why it can have a huge role on bone health, and it can also reduce the risk of falls among older individuals. There are some contraindications, such as if you have high levels of blood calcium or phosphorus. Also, if you have any heart issues or kidney disease, you want to discuss this with your physician before you start this supplement. There's some variation in what the recommended dosage is. The Institute of Medicine put out some recommendations about 3 years ago. This was based on bone health and in reducing fractures. They recommend for most individuals 600 to 800 IUs a day. However, the Linus Pauling Institute actually recommends 2,000, and the Vitamin D Council is even more liberal, and they recommend 5,000. If you're not taking a vitamin D supplement, you don't know what, if you're deficient or not, that's the first thing you want to check. Are you deficient? Is it even necessary to take a supplement? So this is definitely something you want to discuss with your physician. So going along with that, we have calcium. Most of it's contained in our bones and our teeth, so it's obviously important for bone health, but it can also act with helping with the secretion of hormones, as well as sending messages throughout our nervous system and the contraction of muscles. It's found naturally in dairy products, leafy green vegetables, and fish with the bone included. There are some contraindications. You may have heard about this in the news. Preliminary studies show that it may increase the risk for atherosclerosis, and it also may reduce the absorption of magnesium. In terms of dosage, it can range from 1,000 to 1,200 milligrams a day. For individuals with breast cancer, we typically recommend at least or around 1,200 milligrams a day because of the effects of treatment on the thinning of your bones. And also with that, if you are taking a calcium supplement, if you're taking a multivitamin, you want to check and see where is the calcium coming in your diet. A serving of dairy typically has around 300 milligrams. So if you know you're getting a lot of dairy in your diet, you want to count that. If you're taking a multivitamin, look at how much calcium is there, because you don't want to overdo it with the calcium. So see if you're falling within that 1,200 milligrams a day. The next supplement we have here is omega-3 fatty acids, or fish oil. It's been found that individuals with cancer have a 50% lower blood level of omega-3 fatty acids. And these fatty acids are associated with muscle loss and adipose tissue loss. And this might be why it has been associated with fatigue among individuals with breast cancer. So by preserving that muscle mass, it may be helpful. And we found that preliminary research says that DHA, which is a type of omega-3 fatty acid, may attenuate breast cancer mets to the bones. However, this is preliminary research, so it warrants further investigation.
What does that mean?
Attenuate, so it slows down the progression of the mets. Yeah, you're welcome. Next, we have black cohosh. So this is a typical herbal supplement that may be used and may be helpful in the reduction of hot flashes. Most of the studies, there is some variation. Usually they find that the consistent results are when the commercial brand is used, which is Remifemin is one of the examples of a commercial brand. It appears that may be helpful with reducing hot flashes related to menopause, but however, with breast cancer-related hot flashes, it doesn't appear to be as effective. The results really break down as they do higher quality studies. Besides helping with hot flashes, it may potentially act as an antidepressant as well. In terms of breast cancer, we're not really sure how it works. It doesn't appear to bind to the estrogen receptors, and it also appears it may add to the inhibitory effect of tamoxifen. In animal studies, however, they have found that it may promote the aggressiveness of lung mets. As I mentioned, sometimes just because something's natural doesn't mean it's safe. It would appear that black cohosh can increase the toxicity of adriamycin and Taxol, and it may reduce the effectiveness of cisplatin. It may also compromise the liver as well. And Remifemin, like I mentioned, is the commercial brand that you often hear about. The overall recommendation is, for individuals with breast cancer, we do not recommend using black cohosh. Just a couple other topics. Soy is something we often get questions about, and rightly so. There's a lot of questions about soy. Does it inhibit? Does it promote breast cancer? What type of soy should I consume? Does it matter? Menopause status, estrogen status, do these things come into play? About 10 years ago, we recommended no soy because this was based on animal studies where it appeared that it may promote the progression of breast cancer tumors. However, there can be a lot of differences, obviously, between mice and humans. And we found that when we look at population studies now, it's not really holding up. Just to go over soybeans, they're protein rich. They're in the legume family. They're rich in vitamins and minerals like magnesium and potassium, as well as fiber and omega-3 fatty acids. There's a variety of forms you can consume soy in, such as the soybean edamame, as well as tofu, soy milk, miso, and then there's a variety of processed foods out on the market. At the heart of the controversy is what we call the isoflavones, particularly genistein and daidzein. And they can act as weak estrogens, but they can also have anti-estrogen effects as well. You may see them sold as supplements in the stores. Typically, we recommend against using isoflavones as a supplement. You can see here the structure of estradiol, the sex hormone, compared to genistein. It's very similar. So you could see how they may act in similar ways. Couple studies. First, the WELL study, the Women's Healthy Eating and Living study. This was conducted among individuals with early stage breast cancer. They found that when soy was consumed in amounts similar to the amounts consumed among the Asian population, which is very high, that there didn't appear to be any effect on breast cancer prognosis. The next is the LACE study, the Life After Cancer Epidemiology study. They looked at the effects of soy when taking tamoxifen. They found that it didn't appear that soy, when consumed in the whole food form, did not impact the efficacy of tamoxifen. So right now, the recommendation is, even if you're on tamoxifen therapy or aromatase inhibitors, that it's safe to consume up to 3 servings of soy in the whole food form. In terms of using it in processed foods or as a supplement, there's really not enough research to say whether it's safe, because these are much higher dosages, much more concentrated forms of the isoflavones. So you may be asking, what is a serving? So it could be a cup of soy milk, half a cup of soybeans, half a cup of tofu, just as a couple of examples. One other thing, just wanted to talk about alcohol in breast cancer. There was recently a meta-analysis of 25 cohort studies. They found that there appeared to be, when you're consuming greater than 20 grams of alcohol a day, there may be an increased risk of breast cancer mortality. So 20 grams would be greater than a drink a day. When I say a drink, I'm talking about 4 to 5 ounces of wine, 1.5 ounces of liquor, or 12 ounces of beer. And it may really have to do more so with the intensity of the intake of alcohol versus the overall volume. So consuming 4 or more drinks in a day versus spread out over a week could have a bigger impact here. However, with moderate consumption, 1 or less drinks a day, it may actually improve all-cause survival, and this may be related to the lower risk of heart disease. So just to sum it up, I'm just going to conclude with the American Cancer Society guidelines: maintaining a healthy weight, trying to be as physically active as possible, incorporating a number of plant-based foods into your diet, focusing on whole grains, limiting processed foods. I know sometimes this may be more idealistic, but just making those small steps towards healthy living, knowing what you're comfortable with and knowing what your body will allow you to do. So that concludes the presentation, so we'll go ahead and see if we can answer a couple of questions. Thanks. So the first question we have here is there any work being done with the ketogenic diet and breast cancer? We're starting to hear a lot about the ketogenic diet. In terms of breast cancer, I believe there are some studies underway right now, but what we really see is how ketogenic diet may impact brain cancer, and it appears that it may be effective, but in terms of breast cancer, we can't really make any conclusions yet. And this is a very restrictive diet. If it appears that it may be helpful, this would definitely be something you'd want to talk with a specialist about, just to make sure you're still getting plenty of nutrients in your diet. The ketogenic diet is very high in fat, has very small amounts of carbohydrates in it. It has been recommended to keep sugar consumption to less than 20 grams a day. Does this include naturally occurring sugar in fruit and other carbs, or is this added sugars? This is added sugars. So your sugary beverages, your sweets, anything, ketchup. There's actually added sugar in a lot of foods you may not realize, a lot of sauces. One thing that is really being campaigned for is to account for what are the added sugars, what's the amount of added sugar in different foods. Right now you just see sugar, and so that if there's fruit in there, that would include that natural sugar, so we really want to break that apart. So just, if you can, keep track of that. For most people, that's 20 grams or less. The World Health Organization, it used to be that less than 10% of your calories could come from sugar. Now they're really pushing for less than 5%, so that would probably be around that 20 grams a day for most individuals. Once again, you'd really be surprised where sugar can be found. Like ketchup has 4 grams of added sugar per tablespoon. So, if you think about it, that's just a fifth right there if you're only eating 1 tablespoon of ketchup. And then finally, is flax an estrogen lignin? Yes, flax does have lignins that can act as weak estrogens. It's similar to soy in that using flaxseed in its whole form, ground flaxseed, that's considered to be safe if you're doing, 2 tablespoons or less. You don't want to do, extra high doses of these things, but if it's just a part of, your regular diet, it's not in a supplement form, it appears that it should be safe. And then someone asked, no soy with triple negative. Really, the recommendations right now, like I said, it appears that across the board that 3 or less servings a day is considered safe. And like I said, it's in whole soy form, so it's soy milk, tofu, not using the processed foods like I would try to avoid like the high protein bars that have added the soy protein isolate in them. You'll see that listed. Or like the veggie burgers, things like that. That's what I would try to avoid. But if it's in the tofu, the edamame, soy milk, that's considered to be safe. Okay. I think that's it. Oh, there's more. I'm sorry. How much time do we have? Are we okay? Oh.
They were a little off schedule, but it's
Okay.
9:45.
Oh, I'm sorry. I saw that. Okay. What kind of vitamin D should your doctor check for in your blood? So it's the 25-hydroxy vitamin D. That's the lab that they would check for, okay? And it says 1 serving a day of alcohol okay for stage 4. Like I said, so it appears that the moderate consumption, 1 or less drinks a day, and like I said, that's 12 ounces of beer, that can be 4 to 5 ounces of wine, or 1.5 ounces of liquor, for all types of alcohol. It appears that it's safe for, based on the studies that we have, that it would be safe for all stages of breast cancer to consume no more than 1 drink a day. And like I said, try to avoid the high-intensity drinking where you're saying, well, it averages out to 1 drink a day. So, if on Saturday you're having 4 or 5 drinks a day, there could be some problems there. That could actually have a negative effect, trying to make sure that it's no more than 1 drink a day. So, okay. And were the studies about soy consumption done with breast cancer patients with ER, PR positive breast cancer? And yes, I mean, they did look at both estrogen receptor positive and negative. Like I said, it would appear that across the board that soy consumption, not consuming more than 3 servings a day, should be safe. And the main studies that, and you can check these out for yourself, the LACE study, the Life After Cancer Epidemiology study, that was one of them. And then the other one was the WELL study, Women Healthy Eating and Living study. So those are 2 of the big landmark studies that have been done in terms of soy consumption. Yes?
In regards to soy, isn't it true that 90% of it is genetically modified? And isn't that what makes it bad for cancer patients?
Yeah, most of it is genetically modified because of cross-pollination. I'm not sure if that is if that's really what determines how it can be have a negative impact. I don't know if they've looked into that enough to say that it's definitely whether it's genetically modified, but it's definitely hard to avoid eating genetically modified soy. Okay. Yes.
You said about flax, fiber, but for estrogen positive, I know my oncologist told me to stay away from flax in any form because of the estrogenic properties.
Yeah, because it can act as a weak estrogen, but it's similar to soy in that taking it in the food form, based on the studies that are out, it appears that it should be safe. In moderate consumption, if you're incorporating flaxseed into your diet, it should be safe to have 2 or less tablespoons a day. And like I said, and it's a weak estrogen. It doesn't work. It's a plant estrogen, so it doesn't work the same way as human estrogen, and it can also have anti-estrogen effects as well. So, okay. You're welcome. Thank you very much.